Well, in this week's Cardiology News, we have a new analysis of blood levels of Dabigatran in the RELY trial, a look at high-dose statins for preventing kidney injury, acute kidney injury, and also a look at the risk of adverse outcomes following non-cardiac surgery in patients with stents. So to begin with, we have a pre-specified analysis of the pharmacokinetic data from the RELY trial that compared the new anticoagulant Dabigatran versus warfarin and related that also to outcomes. And so it found there were several factors that related to higher drug levels, notably dose, but then also renal function, age, weight, and female gender. Then when they looked at the risk of ischemic outcomes, they were inversely related to Dabigatran outcome. And so the higher the Dabigatran level, the lower the risk of ischemic outcomes, but the higher the risk of bleeding, not surprisingly. And so covariates for the risk of major bleeding were the drug level, age is the biggest, and also aspirin and history of diabetes. And so the authors note that potentially tailoring the dose to patient covariates such as age is something that could be considered. Of course, it can't be in the United States because the FDA only approved one dose, at least so far. Next up, we have another analysis of the effects of high-dose statins, and this is from the PRATO-ACS study that used high-dose rosuvastatin, 40 milligrams at the time of admission, versus control and then later statin therapy, to see if there were an effect in preventing peri-PCI acute kidney injury. And they found that the high-dose statin strategy did in fact significantly reduce the risk of acute kidney injury, that is an increase in creatinine of 0.5 milligrams per deciliter or a 25% relative increase. And it was about more than 50%, from 6.7% with the statin coming down from 15.1% for the no early statin use. Interestingly, there was even a trend towards lower death or MI, and overall major cardiac or renal events were also significantly lower. So further evidence supporting high-dose statin therapy on admission. And then the top pick this week is an analysis from the VA database looking at the ever-vexing question of what timing should one recommend for non-cardiac surgery in patients who have had stents. And they looked over a 10-year period at a total of 42,000 patients roughly. Of this cohort, there had been 124,000 stents placed, and in that group then 28,000 went on to have surgery. So they put in some controls into this analysis and found that the biggest predictors of major adverse cardiac events were recent MI within 6 months, an overall cardiac risk index as a standard, and then also non-elective surgery. So some of the more basic things, but stent type was not a factor. And so they recommend reanalysis a little bit of current guideline recommendations for timing of non-cardiac surgery. So for this week's Cardiology News on CardioSource, I'm Chris Cannon.